Welcome. In this video, we'll delve into the world of diabetic retinopathy, a serious eye condition that can affect people living with diabetes. We'll explore what causes it, how it damages the eye, how it's diagnosed, and what can be done to treat and even prevent it. So, let's get started. Diabetic retinopathy at its core is caused by high blood sugar levels over time. This sustained hyperglycemia, a hallmark of diabetes, damages the tiny blood vessels in the retina, the light-sensitive tissue at the back of your eye. Think of it like this. Consistently high sugar levels are like pouring corrosive syrup into delicate machinery. Eventually, things are bound to break down. Now let's look at the pathophysiology. High blood sugar damages the blood vessels in the retina. Initially, these damaged vessels may leak fluid and blood, causing swelling and blurry vision. This is the early stage, known as non-proliferative diabetic retinopathy or NPDR. As the condition progresses, the retina starts to suffer from lack of oxygen due to the damaged blood vessels. In response, the eye tries to grow new blood vessels, a process called neovascularization. These new vessels are fragile and prone to bleeding, leading to more severe vision loss. This advanced stage is known as proliferative diabetic retinopathy or PDR. Diabetic retinopathy is a significant public health concern. It's the leading cause of blindness in working-age adults. The prevalence of diabetic retinopathy is directly related to the duration of diabetes and the level of blood sugar control. In other words, the longer you have diabetes, and the less controlled your blood sugar is, the higher your risk of developing this condition. It affects both type 1 and type 2 diabetics. Statistics show that a significant percentage of people with diabetes will develop some form of diabetic retinopathy in their lifetime, highlighting the importance of regular eye exams. In the early stages, diabetic retinopathy may have no noticeable symptoms. As it progresses, you might experience blurred vision, fluctuating vision, seeing spots or floaters, impaired color vision, or even vision loss. It's important to understand that vision changes can be subtle at first, making regular eye exams crucial for early detection. Diagnosing diabetic retinopathy relies on a comprehensive eye exam. An ophthalmologist will dilate your pupils with eye drops, allowing them to see the retina more clearly. They'll look for signs of damaged blood vessels, swelling, bleeding, and new blood vessel growth. Additional tests like fluorescein angiography, where a dye is injected into your arm and photos are taken of the retina, and optical coherence tomography OCT, which provides detailed cross-sectional images of the retina, can help assess the severity of the condition and guide treatment decisions. Diabetic retinopathy is broadly classified into two main types: non-proliferative diabetic retinopathy and NPDR, and proliferative diabetic retinopathy, a PDR. NPDR, the early stage, is further categorized as mild, moderate, or severe based on the number of microaneurysms, hemorrhages, and other retinal abnormalities. PDR is the advanced stage characterized by the growth of new, fragile blood vessels on the retina or optic disc. Treatment for diabetic retinopathy depends on the stage and severity of the condition. For mild NPDR, careful monitoring and improved blood sugar control may be sufficient. More advanced NPDR may require laser treatment to seal leaking blood vessels. For PDR, options include laser photocoagulation to destroy abnormal blood vessels, and a surgical procedure called vitrectomy to remove blood and scar tissue from the vitreous gel inside the eye. Anti-EGF injections, medications that block the growth of new blood vessels, are also commonly used in the management of both NPDR and PDR. Prevention is key when it comes to diabetic retinopathy. The best way to prevent or delay the onset and progression of the disease is to maintain good blood sugar control through diet, exercise, and medication as prescribed by your doctor. Regular eye exams are also crucial. Even if you don't have any symptoms, early detection and treatment can significantly reduce the risk of vision loss. The prognosis for diabetic retinopathy depends on the stage of the disease at diagnosis and the effectiveness of treatment. With early detection and appropriate management, many people with diabetic retinopathy can maintain good vision throughout their lives. However, without treatment, the condition can lead to significant vision loss and even blindness. Recent research is focused on developing new treatments, including more targeted anti-VEGF therapies and gene therapy approaches, to further improve the outcomes for people with diabetic retinopathy. Furthermore, advancements in artificial intelligence are being explored to aid in earlier and more accurate detection of the disease through automated image analysis.